Around the world, nations face the urgent challenge of tobacco use and oral disease. As we strive for a healthier, more equitable future, oral nicotine pouches, or ONPs, are emerging as a powerful, evidence-based solution. Their story is global, their impact profound.
Sweden stands out as a pioneer. By embracing oral nicotine pouches and risk-proportionate regulation, Sweden has achieved record-low smoking rates and reduced the burden of oral disease. Accessible, affordable, and well-regulated oral nicotine pouches have helped populations historically underserved by traditional cessation programs.
In the United Kingdom, oral nicotine pouches are part of progressive tobacco harm reduction strategies. Policymakers promote regulated access for adults seeking alternatives to smoking, while strict age controls and marketing limitations protect youth.
The regulatory environment is evolving in the United States. The FDA reviews emerging evidence and considers public health, youth protection, and equitable access in its oversight of oral nicotine pouches. Some states have launched pilot programs to monitor long-term outcomes.
Countries like Kenya, India, and Brazil are assessing culturally compatible harm reduction approaches. LMICs face challenges in integrating oral nicotine pouches, but have opportunities to leapfrog outdated cessation models and adopt innovative solutions tailored to local needs.
To maximize the impact of oral nicotine pouches, integration into non-communicable disease, oral health, and tobacco control frameworks is essential. This includes alignment with the WHO Framework Convention on Tobacco Control and the Global Strategy on Oral Health.
Countries must work collaboratively, sharing best practices and harmonizing standards for product safety, accessibility, and education.
Monitoring underage use without sacrificing adult access. Regulations should ensure that oral nicotine pouches are strictly age-gated. This protects youth while preserving adult access for smoking cessation and harm reduction.
Implementing targeted interventions. Use robust data to design interventions that prevent youth uptake. Regularly review and adapt policies based on emerging evidence, prioritizing both prevention and adult cessation.
Supporting global evidence and innovation platforms. Establish international and national observatories to track health outcomes, guide research, and inform investment in next-generation nicotine technologies. Ensure equitable benefits across income levels and social groups.
Introducing risk-proportionate regulation. Regulate oral nicotine pouches according to their risk profile relative to traditional tobacco. This means lower-risk products should be more accessible and affordable, with clear labeling and consumer information.
Transparency and inclusion. Engage communities, public health experts, and policymakers in the regulatory process, ensuring transparency and inclusion at every stage. Design policies that make oral nicotine pouches affordable for smokers seeking alternatives, especially in LMICs, where cost is a barrier to cessation.
Marketing restrictions. Limit advertising and promotional activities to prevent youth appeal, maintaining a focus on adult smokers and their health outcomes.
Scientific studies and real-world experiences converge on the same imperative. Oral nicotine pouches, when well regulated, can accelerate progress toward global smoke-free targets and reduce oral disease. Sweden's blueprint, the UK's harm reduction model, and LMICs' innovative approaches show that with evidence-based leadership, diverse nations can succeed.
Integrating oral nicotine pouches into the global health agenda is more than a scientific decision. It's a commitment to equity, sustainability, and human rights. The stakes are high. Tobacco use threatens 1 billion lives this century, and oral diseases compromise quality of life for millions. The tools for change exist. Now we need the resolve to act.
The global case for oral nicotine pouches is clear. Policymakers, public health leaders, and oral health experts must follow the evidence, adopt progressive regulations, and deliver on the promise of a harm-reduced, healthier future for all. The time to act is now, for a new generation free from the burdens of tobacco and oral disease.
The global case for oral nicotine pouches is clear.
Policymakers, public health leaders, and oral health experts must follow the evidence, adopt progressive regulations, and deliver on the promise of a harm-reduced, healthier future for all.
Integrating oral nicotine pouches into the global health agenda is more than a scientific decision. It's a commitment to equity, sustainability, and human rights.
The time to act is now for a new generation free from the burdens of tobacco and oral disease.